First item on the agenda, after roll call, I guess we need roll call first. Kim?
Senator Boswell.
Here.
Senator Douglas.
Here.
Senator Yates. Representative Chester Burton. Representative McCool. Representative Pollock. Sorry, Representative Hart.
Here.
And Chairman Meredith.
Present. And I'm sure you folks are just like me. You hope and pray that we're not going to have to hear this for the next hour and a half, but we'll try to endure best we can. First item on the agenda is consideration of the minutes of the May 9th meeting of the committee. Is there a motion that be considered approved?
Motion be approved. Second.
Motion and a second. Kim, please call the roll.
Senator Boswell.
Here.
Senator Douglas.
Aye.
Senator Yates. Representative Chester Burton. Representative McCool. Representative Pollock. Representative Hart.
Yes.
Chairman Meredith.
Aye. Motion. Motion carries. Total number of items on the agenda today are 505 in the amount of $249,513,407.74. All vendors are registered with the Secretary of State's office. Next order of business is consideration of the agenda, including the personal service contract list, PSC amendment list, memorandum of agreement list, memorandum of agreement amendment list, the Kentucky Entertainment Incentive Program agreement list, and the corrections list, except for those items selected for further review. Do I have a motion to consider the contracts reviewed without objection?
So moved. Second.
Motion by Co-Chair Hart, seconded by Senator Douglas. All in favor vote aye. All opposed no. Kim, please call the roll.
Senator Boswell.
Aye.
Senator Douglas.
Aye.
Senator Yates. Representative Chester Burton. Representative McCool. Representative Pollock. Representative Hart.
Yes.
Chairman Meredith.
Aye. Motion carries. First item on the pool list with the Department of Income Support is number 9 on the routine PSC list. Representatives here, please come forward and identify yourself for the record.
Good morning. Thank you, Mr. Chair. I'm Wesley Phelps, Disability Determination Services, Department for Income Support.
Appreciate you being here this morning. We have a new process in place we started last month. If you would, I'd ask you to raise your right hand. Do you swear or affirm to tell the truth, the whole truth, or nothing but the truth?
I do.
Thank you. Appreciate you being here. I request this contract be pulled. I think it's a pretty simple question for you. Let me find it. Yes. Under all these contracts, each one's $384,000 with the exception of number 9, which is $516,000.
Yes.
Why the difference?
This is a unique situation. That vendor had to change their vendor number, and they also changed their vendor number to include their LLC instead of their social security number for taxes. So this contract is not just the next fiscal year renewal. It includes the remaining funds from this fiscal year so that they could be put under that new vendor number.
Okay, I guess I understand that.
Seems like we didn't let us know that, so we want to be here.
Yeah, the conversation up here is it'd be nice to know those, so we wouldn't have to pull you in here and take your time. But I understand the explanation. So
Sure.
It's a carryover from the previous contract, and if we pull that carryover out, then it would be $384,000. Is that correct?
The $384,000 on fiscal year 24 contracts is also a new total because the rates were raised by Social Security.
All right.
But it
Thank
would
you.
match the total from FY23.
Okay. Thank you. Appreciate that.
Thank you.
That's all the questions I have. Any other questions, comments? Not entertain a motion? Motion by Co-Chair Hart, seconded by Senator Boswell. All in favor vote aye. All opposed no. Kim, please call the roll.
Senator Boswell.
Aye.
Senator Douglas.
Aye.
Senator Yates. Representative Chester Burton. Representative McCool. Representative Pollock. Representative Hart.
Yes.
Chairman Meredith.
Aye. Motion carries. Thank you for being with us this morning. Appreciate your time.
Thank you. No problem.
Next item on the pool list with the Department of Public Health and is number 13 on the PSC green list. They don't even have to tell our representatives to come forward. They're eager, anxious to.
We're here for you, Chairman Meredith.
I appreciate that. I certainly do. If you would, you heard previously, I asked you to raise your right hand. Do you swear and affirm to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you. If you would, please identify yourself for the record.
Adam Mather, Inspector General for the Cabinet.
Mike Tuggle, Assistant Director, Administration, Financial Management of Public Health.
Thank you. Appreciate you being here. This is a big contract. $25 million for disease testing. Certainly understand that, and it covers multiple vendors. My question is this statewide coverage?
Yes.
Then that leads to my specific question is, I notice there's not a single vendor west of I-65.
It was an open procurement situation, so anyone was allowed to sign up for that.
Well, I appreciate that. Don't you think that's a little bit strange, though? I mean, everything's east of I-65.
Yeah. I mean, there are more vendors that we have that are available to do the testing than actually are providing the testing through the contract. We have 12 vendors that are actually doing the testing. Yeah, I couldn't explain that to you. I think that's probably a broader question.
Well, I would hope it would be, because a lot of great communities west of I-65, Elizabethtown, Owensboro, Bowling Green, Paducah, and it was too obvious that.
Yeah, it was open procurement. Anyone could have signed up, taken part in this. So.
Well, given the history of this, do you yourself ask, how come we don't hear from anybody on the other end of the state?
I would be speculating if I answered that. I don't know the answer to that.
Well, I wouldn't want you to speculate. That always gets us all in trouble.
That's
but
right.
That's the question I have, Senator Douglas.
Just to follow up with that, because I wouldn't want you to speculate, did you actively seek out any of them for their reasons for not wanting to apply?
No, we did not.
Could we do that next time?
Sure.
Thank you. Thank you, Mr. Chair.
Thank you, sir. Senator?
Yes, sir. My question is this: there's quite a bit of talk about COVID-19 on here. I mean, COVID is, in a sense, somewhat behind us. Wouldn't that reduce the overall cost of a program like this if a lot of it was going to COVID testing?
Yeah, we're seeing the program, the amount of tests dwindling. This is specific for long-term care facilities, so this is the most vulnerable populations. So they are continuing to do these tests.
So how much was this last year?
Do you have the last year figures?
For FY23 current year, or
Right. Yeah.
yeah, 23, it's about 12, almost 13 million to date, and to date means about April invoices. May's still trickling in, but there's been about 13 million spent on a $25 million contract current year.
Okay. So why is it 25 million this year?
That's what's available in our federal grant award to support their vulnerable populations.
So
of the
if you get the
LTCs.
money, you're going to spend it. In other words, is that one of those things where the governments, if they give you 25 million and you have to spend it?
Well,
Kind
if we don't, it'll go back. So the money is set aside for this specific initiative. So if we don't use it, it would be returned.
That's all.
Representative Hart.
I think I might have got my answer. Listen, in addition to COVID, I'm assuming this does testing for like the flu and other types of illnesses and diseases. Is that correct?
I believe it's just COVID-19.
Oh, and this is just for COVID-19. Okay. All right. Thank you.
So what happens after 2024?
It will go back to the providers will start having to bill out those services to the lab or to their insurance.
So no federal funding. We'll rely on commercial insurance and Medicaid.
Right, and then I think the facilities will take on some of the burden for their uninsured employees.
All right, thank you. Any other questions? Not entertain a motion to approve.
So moved.
Motion by Senator Boswell, second by Representative Hart. All in favor of the motion vote aye. All opposed will vote no. Kim, please call the row.
Senator Boswell.
Aye.
Senator Douglas.
Aye.
Senator Yates. Representative Chester Burton. Representative McCool. Representative Pollock.
Yes.
Representative Hart.
Yes.
Chairman Meredith.
Aye. Motion carries. Gentlemen, appreciate you being available to us this morning, and have a blessed day. Next item on the pull list with the Department of Insurance, and is number 23 on the routine PSC green list. Good morning. Appreciate you joining us. If you would identify yourself for the record.
Good morning. Sean Boggs, Deputy Commissioner of the Department of Insurance.
Again, thank you for being here. I'd ask you to raise your right hand. Do you swear and affirm to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you, sir. Appreciate it. My question on this contract, I found it very interesting, is conduct a market analysis. It says specifically to provide funds to examine the affairs, transactions, business accounts, records, documents, and files of the insurers or other entities / persons regulated by the Department of Insurance and authorized to transact insurance business in the Commonwealth of Kentucky. What are you going to do with this
What
information?
does that mean? Basically, what a market conduct exam is an audit of the business practices of the insurance company. And what we look at when we go in and do a market conduct exam are the regulated entities' operations, how they license their agents, underwriting and rating practices, complaints, appeals, and grievance practices, claims settlement practices, marketing and sales practices. We do rely on the legislature to provide us with the laws. This is kind of our way to go in and check and make sure that the companies are abiding by the laws.
Is this well, the contract is certain 23-24 is, so is this an annual review?
It is. Most companies are on a schedule, but we can go into a company earlier than they're scheduled if we notice in our, say, consumer complaints division that we're receiving a lot of complaints on company X. We can move up, go into a company sooner, or we could do a targeted exam on a specific instance, say, complaint handling.
So it's not necessarily an annual review?
It's not annual. It's usually a company would have a review every 3 to 5 years, because you have to cycle through, and we don't have a lot of examiners.
So it's on a sampling basis?
Yes, sir. When we would go into a company, we would pull a sample, say for 2 years, and examine
A
at time-
random
time.
sample?
Yes, sir.
Unless you receive an inordinate number of complaints, concerns,
Yes,
then you could do
a targeted.
okay,
Yes, sir.
appreciate it. All righty. That's all I have. Anyone else? I'll entertain a motion to approve.
Second.
No, we've got people awake and jumping all over here. Representative Polly made the motion, Senator Boswell made the second, from what I heard. All those in favor of the motion, vote aye. All opposed, vote no. Kim, please call the row.
Senator Boswell.
Aye.
Senator Douglas.
Aye.
Senator Yates. Representative Chester Burton. Representative McCool. Representative Pollock. Representative Hart.
Yes.
Chairman Meredith.
Aye, motion carries. Thank you for being here this morning. Appreciate the information. Appreciate the education.
Yes, sir. Thank you.
It's always good to know how state government works, isn't it? Next item on the pool list are with Eastern Kentucky University. Our numbers 30 through 34. If representatives are here, please identify yourself for the record.
Good morning, Senator. My name is Micah Hunsucker. I'm the Director of Procurement at EKU.
Thank you. Appreciate you being with us this morning. Are you solo? You by yourself this morning?
No, sir. I have Brian Mackinnon, our Director of Facilities and Associate Vice President with me today.
Okay. I'd ask both of you to raise your right hand to affirm that you do swear to or affirm to tell the truth, the whole truth, and nothing but the truth.
I do.
All right. Thank you. Appreciate it. This is an educational opportunity for me, and I hope from other committee members. It's a process through no fault of you folks that I really don't like. You know, we've got numerous contracts that you folks have presented to us for smorgasbord of services, and they're all like $600,000. So again, you folks have not done anything inappropriate or wrong. I'm just trying to understand the process and hopefully provide some information to our committee members so that we can all do our jobs a little bit better. Like, let me pick the first one, $600,000 for civil engineering. And this is a budgeted amount. We don't actually have contracts that are ready to be extended for $600,000. Is that a fair assessment of this whole process?
Yes, sir, it is. These contracts, we put these in place every year so that we can have these trade services available when we need them, in the event of emergent activities or something like that. So it is a budgeted amount, but we don't necessarily use every dime of the money budgeted for these contracts.
I've made this request from the University of Kentucky, and they have agreed to do so. It's hard for me to ascertain whether this is an appropriate expenditure amount or not because I don't know the history. And every year we're presented with these requests for spending levels, if that's an appropriate term, but we really don't know in retrospect how much you've actually spent. And so I don't know first how you come up with $600,000 for each of these, and secondly, I don't know how much you've spent in the previous year or biennial, so I have a hard time ascertaining where this is an appropriate amount or not. So would it be unreasonable of us to request a follow-up report? Again, University of Kentucky does this to tell us how much you've actually expended of the $600,000 for each of these categories. Is that a fair request?
I think it would be. Our facilities folks are really great about tracking their spend. They're excellent budget managers, so it would not be difficult for us to do that at all.
Well, I hope you understand. You want to see $600,000. Where's the science behind this? I'm sure it's based on historical performance. Should be, could be. But if you've only spent $200,000 one year, and the next year you come back with $800,000, there's just no rhythm of that or logic to that. So I think it would be beneficial for me, particularly if I knew what you were doing retrospectively.
Sure. Again, as I said, our facilities folks are excellent budget managers. They're excellent fiscal stewards, and it would not be difficult for us to provide that type of report.
All right, thank you. Any other questions from committee members?
I have two questions.
Yes, Senator Boswell.
Regarding 2023 environmental assessment. Could you explain what that is?
Yes, I'd be happy to. This is Brian Mackinnon with Facilities Management and Safety, and certainly a pleasure to be with you today. Environmental assessment can be a variety of things. For instance, if we have to have asbestos abatement of a house we're going to demo, all the way to if we have an environmental concern that we need to bring a contractor in to assist with. This gives us some bandwidth to help us to mitigate or abate a project in a legal and ethical manner moving forward. And it gives us that bandwidth to immediately tap into one of several different firms, whichever one could respond the quickest to assist us with those needs.
These are projects that are on site at the university? Are these on-site projects at the university? Where are these projects? Are there?
That's correct. They could be on any one of our owned or controlled properties by the university. So it could be the Richmond campus, could also be our Corbin, Manchester campus, things of that nature.
Well, I don't have any other questions other than to say that I think that sometimes I'm getting completely carried away on these environmental things. One more question on the last item here on the list of 2020. I built out a house.
I'm sorry, sir. We're unable to hear you.
I got it. Okay, the last question I have is on the item number 20502023 regarding interior design. I've been involved in a lot of building projects and things, and that sounds awful excessive to me for interior design work. I mean, what kind of what kind of operation is going on when you're spending $400,000 to get somebody to do interior design?
This would be a ceiling level. The intentions are to not meet this level, just to give us the authorization for the bandwidth to do so. It could be the designing of a project, for instance, if we were to do a refresh of a lobby would be an example, or as we look at our classroom spaces, bringing them up to a modern design and field, which would also include IT infrastructure, things of that nature, getting design concepts for those, just as a couple of few examples. The intention is not to utilize $400,000. It's to give the bandwidth should we have a need moving forward for an interior designer. We can, as Ms. Hunsucker stated, can absolutely provide you a historical utilization of this particular line item to give.
That's what I'd like. That's what I'd like, just like Senator Meredith had on the other items. I think we need to have some reference before we can start throwing some big number out there. So if you'll provide that. Thank you.
Absolutely, be our pleasure.
Senator Douglas.
Thank you, Mr. Chairman. I just wanted to follow up on what Senator Boswell was talking about, and you can clarify this for me. We're putting this in here in case you need it, not because you've already planned for it.
Yes, sir, that's correct.
Okay, thank you very much. Thank you, Mr. Chair.
Any other questions, comments? If not, entertain a motion to approve. Motion by Senator Boswell. Is there a second? Thank you, Representative Pollock. All those in favor of the motion vote aye. All opposed vote no. Kim, please call the roll.
Senator Boswell.
Aye.
Senator Douglas.
Aye.
Senator Yates. Representative Chester Burton. Representative McCool.
Yes.
Representative Pollock.
Yes.
Representative Hart.
Yes.
Chairman Meredith.
Aye, motion carries. Thank you both for being available to us this morning. We appreciate the information.
Thank you, Senator.
Thank you, Senator.
Next item on the pull list are with the economic development and our number 38 and 43 on the routine PSC list. And they're approaching the bench en masse here. So good to see you all this morning. How you doing?
Doing great. How about yourself?
Another day in paradise.
That's
Surely is.
right.
Blessed beyond measure. If you would, first, please identify yourself for the record.
I'm Katie Smith. I'm the Deputy Secretary at the Cabinet.
I'm Monique Kirkendall-Quarterman. I serve as Executive Director for Entrepreneurship and Innovation at the Cabinet.
Good morning, Matt Wingate. I serve as General Counsel for the Cabinet.
Again, appreciate you being here this morning. If you would, please raise your right hand. Do you swear and affirm to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you. I requested these contracts be pulled. First, I've always been very supportive of this. I think it's great that we've got this regional concept in terms of economic development. But I'm starting to get some tenure on me now, and I've seen these contracts for some time. And what I want to know is how are we measuring success for each of these offices?
Thank you for that question. We have implemented a metrics process for the 6 regional Kentucky Innovation Hubs. They represent entrepreneurial support for 120 counties. They track in a common system outcomes. And for example, the outcomes that we show so far for the previous fiscal year are over 1,900 startups served, over 650 referrals that sometimes result in investment, sometimes result in great connections that allow these businesses to grow. They also reported over 200 events with 7,000 attendees. So this measures the amount of influence going into community to encourage the community to start a business and grow from there. We also have a gross reporting from those hubs of over $63 million in startup investment as a result of this initiative.
Who gets to review that information? Do y'all report to our committees for economic development?
We do an annual report, and it's submitted to the governor's office and to LRC every year. It's due November 1st, and so it has all of our different programs and all of our information, and so this information is included in those annual reports, and I believe they're also available on our website.
Does she also track business failures?
I'm sorry, could
Do you
you please
also track business failures? Because you have a lot of startups, and we know there's usually a high percentage of new businesses that don't succeed. Do you have that information as well?
No, I do not. We don't currently track the amount of business failures across the Commonwealth at this current point.
Should we? I would think we should, because if you start for discussion purposes of 500 new businesses, but 450 failed the first year or 2 years, then I'm not sure how successful we have been.
I'm happy to reach out to the Secretary of State's office for dissolution records and see if we can collaborate.
I think that would be important information for us to determine how to do this going forward, particularly on a regional basis. And which leads to another question: is do we look at expanding this service to other areas other than the 6 that presently have offices?
That's a great question, and thank you for it. We have heard a lot of interest from our communities. A lot of these communities across the Commonwealth have been inspired to start their own hubs within the Kentucky Innovation Hub system. Of course, it's all dependent on available funding, and so we try to communicate to our community to support entrepreneurship as much as possible, because it is really moving the needle for a lot of geographic areas across Kentucky.
Do you think the experience in each of the 6 regions have been comparable to each other, or are some doing significantly better or significantly worse than others?
That's a great question. It depends on the different characteristics of an area. We have Kentucky Innovation Hubs in rural parts of the state, also in urban parts of the state. We try to address them to be able to grow equitably. But of course, there are different paces, different types of businesses. We try to encourage our Kentucky Innovation Hubs as community-driven, community-owned organizations to meet those businesses where they are and help them to grow.
I also want to point out that this contract will be the last year for renewals, so we do plan to do another RFP. We don't do renewals every 2 years. We do annual renewals on these types of contracts, so we can make sure we have the right metrics in place and the right budgets for these contracts. So next year we will be doing another RFP to hopefully open it up for more to respond. So we might have other offices that potentially could be available in different areas next year, depending on the responses to the RFP.
Well, another thing I've noticed in the contracts is they're not all for the same amount. Can you give me an explanation to that?
Those originally from the budgets are what each of those different areas had requested the needs. And then if you want to add.
Absolutely. It's in part from the response from the original RFP for this opportunity, but it's also reflective of other aspects like private investment coming from community, local contribution into the success of these hubs, but also population as a whole. So we try to consider multiple opportunities and aspects in funding these hubs.
Is the methodology a little bit distorted in that? I think we need to do a better job of getting the resources to the most disadvantaged communities. And do you think the RFP will reflect that?
So the RFP reflects it, and I think they do a great job now. They work together, so it's not just that region. If somebody has experience in a certain area from northern Kentucky, and there's an entrepreneur in eastern Kentucky that's looking at that, they will reach out to them and they will connect them. So it's a team approach. So it's not just staying by region. They are truly working collectively across the state. Each of those hubs are. So, and that's one of the things that we do include in that RFP is that they will be working together and willing to collaborate across the state with other offices.
Yeah, an entrepreneur in a certain region isn't simply confined to using the resources in that region.
Right.
If someone at that hub identifies that this person has expertise in this other region, they can rely on those resources.
Well, again, I've always been supportive of the program, but it still concerns me that we don't get our resources to the most disadvantaged communities, and that's not a criticism of you folks. I think it's many times just the methodology we use in putting these programs together, but again, not meant as a criticism. Senator Douglas?
Thank you, Mr. Chairman. I would ask you to make sure you got a pen in hand, because I've got a couple of requests for you, if you would please. You're right. It is a team approach, and what we're asked to consider is whether contracts should be renewed and or considered and carried on. And that data would be extremely helpful to us. And here's two pieces of data that I'd like to have included in the requests for any future contracts to this committee. One is I'd like us not only to track the business failures as / successes. We need that data to be able to assess whether or not the contracts are viable, whether we should continue these contracts. Right. That's really important to the committee members. We actually do read and we do pay attention, and this would help us tremendously. Number two, it would help this committee a great deal if we could track success in the different areas so that we can compare how we're doing based on the money we're spending. We really want to be more involved and more engaged in making these programs a success and possibly spreading these programs to other areas of our Commonwealth. And so those two things, my request is, in any future requests for contracts, those two bits of information be present for us to review. Thank you very much. Thank you, Mr. Chair.
Yes, sir.
Senator Boswell.
Yes. So on these contracts, at the bottom of the section, it says that the fundraising and sustainability plan exhibits the organization's ability to become operationally sustainable within 3 years without state funding. When did these contracts begin, and are we making any progress where the state will not be funding these? I mean, these programs, I find that we tend to start programs and we continue to fund them forever. The economy is doing great right now. The businesses are flourishing, and I'm not sure that the long-term need to continue a contract like this, but I'm just curious as to this first question about the sustainability and when the state should be able to quit funding this project.
Yes, sir. Thank you for that question. This is the third renewal of the contract. We have monitored the hub's ability to become self-sustainable along the way. What we found in monitoring the outside funding coming into these hubs from communities, federal government, also philanthropic contributions, is that they're hovering somewhere between 15 to 30%. Part of it is because they're trying to meet the needs of community, especially for some of these areas that are underserved, are disadvantaged. The burden of trying to close that gap of funding is a lot harder to become self-sustainable.
So you're saying that part probably should be eliminated from your contract as far as what we see, because it's you're saying here it's going to be sustainable, but it's clearly not going to be sustainable.
I think that language may have been carried forward from a previous description. So the previous executive director, Tony Ellis, was very engaged in this program, as is Monique. He had the foresight to look and envision metrics, how we can get data-driven approaches to these hubs. I think that without having the data, it's hard to really assess if sustainability is overly ambitious. Now that we're getting 2 years or so worth of data coming in, we can really assess where our needs are, where the sustainability approach is, what's realistic, because at the end of the day, you don't really want to penalize entrepreneurs in these communities that you're trying to build this type of infrastructure by not adequately funding them from the get-go and thinking that everybody can be sustainable, when really the regions need to have a tailored approach, and we're now getting that data to be able to assess that.
Yes, I understand, but I guess what I'm saying is, in the beginning of this program, when it was first brought to the legislature or whoever was funding this information was put in there. And so the funding therefore came forward based on probably these words saying that this would be sustainable. So then my last question is this. Can you tell me a little bit about the program in regard to a section here in the middle? And I'm going to read it, and maybe you can give me some explanations exactly what this means. It says that develop and implement a plan to address inclusiveness within the region, including developmental supporting programs within the region to engage minorities, women, and other diverse individuals and entities. Clearly, the minorities is based on past experiences, pretty self-explanatory. And the women, can you explain to me what it means here by inclusiveness and diverse individuals?
Yes, thank you for your question. That language has remained in the contract for each of the previous renewals. One of the goals is that Kentucky, in partnership with the federal government, has access to small business investment opportunities. And as part of those opportunities, some of those incentives that were available to Kentucky were on the basis of being able to support multiple communities, including rural, urban, veteran-owned business, women business owners, ethnic differences. We want to make sure that we're able to effectively spend those investment dollars coming into Kentucky, and our hubs support us in that process by providing referrals for investment into those startup businesses.
Yes, and so, again, my question is, what do we mean here by inclusiveness and diverse individuals?
Yes. So what we mean by inclusiveness and diverse individuals would be really addressing the full community. So it may be veteran-owned businesses. It may be women-owned business. There is a full list available from the U.S. Department of Treasury as part of the State Small Business Credit Initiative program. I'm more than happy to share that information for that full definition.
It just seems like to me that anyone who wants to form a small business or be helped should be helped. And I don't know that we need to be specifying any particular category of individuals. I'd like to see everyone helped, regardless of whether they're minority or if they're middle income, or no matter what color they are or whatever. And I start to get a little concerned when I see these words in there, because I'm not a big fan of words like inclusiveness and diverse individuals. Thank you.
Thank you, Senator. Senator Douglas, you have a question or follow-up?
No, I'm sorry, Mr. Chair, misunderstanding. My apologies.
Just to follow up on Senator Boswell's point, and this is more of an editorial comment, is when we look at developing these programs, I really would like to see special attention given to rural communities. Again, in my 7 years here, when I look at the budgeting process, we talk about it, but we don't commit the resources to it. And that's where I think our biggest pools of poverty reside. And I think we certainly focus on Eastern Kentucky and the problems they struggle. But if you look at the last census, those areas are becoming more pronounced throughout the state. We're losing population on the west end and the east end of our state, and it's directly related to poverty, lack of jobs there. So I would hope that we would give special attention to rural economic development in this process. And I think we get a double bonus there. First, we get new tax revenue from those businesses, but we also help remove people from entitlement programs and the associated payments. So I think in terms of an economic strategy, that's where we get our greatest return for Kentucky, is to focus on those communities.
I do want to give a little pitch for the SSBCI program that it's the 2.0 that Monique was referencing. For those communities, and a lot of them are rural communities that are defined, and this is those definitions of socially and economically distressed individuals, they could be eligible for a higher participation. So right now, the maximum under our previous program was up to 20% of potentially a loan participation or collateral support. In those areas, we can participate up to 50%. So we are truly, we're starting to roll those programs out and starting to market those programs, and so I do want to give a little pitch to that as well.
Well, thank you. Appreciate that. And, you know, I know that you folks don't fight this battle alone. Part of the major struggle for rural communities is lack of broadband. Mm-hmm. And you can't compete in the national, international economy if we don't have access to that. Our legislature certainly made the commitment with $350 million to do that. I think we're seeing results for it. But we have to understand that it's going to be difficult to recruit businesses to rural communities if that infrastructure is not in place. So I think we got to make a disproportionate investment in rural communities to lift the tide for everyone. But again, Senator Douglas.
Thank you, Mr. Chair. This is my ignorance, so you can really help me out here. We talk about rural communities. We have 120 counties in the Commonwealth. How many counties are considered rural communities?
That's a great question, and thank you for it. It all depends on the program. For the Kentucky Innovation Hubs, we didn't come up with a specific measure. However, with 6 regional hubs, including all 120 counties, we try to reach out all entrepreneurs across the Commonwealth of Kentucky. For some of our federal programs, as mentioned, the SSBCI program, they do have a formula on the federal level by which they determine rural, and that does give additional incentive availability for communities.
Well, I thank you for that answer. But it doesn't, and I say this respectfully because I'm a dumb old guy. That doesn't help me. I don't know. We are a pretty rural Commonwealth. And even within our rural Commonwealth, we have areas that are more rural than others that need the economic development. And if we're going to define everyone as rural, we're still not, as Senator Meredith has already pointed out, really reaching out to those communities that may need it more. I just want to express that as a concern.
So under some of our, again, other incentive programs, we have a definition, and it's in the statute, that calculates the enhanced incentive counties. And we can share that statutory reference if you'd like. And what that does is, and you're going to, I'm working off of memory here from a while back, but there's a calculation. It looks at unemployment rates. It looks at, I think, access to roads and infrastructure and things like that. But I believe at least the 60 lowest unemployment rate counties are definitely in there. And then I think there's other calculations as well. And I am going to, I think around 80, would you say 80 to 90 counties might be considered?
It's closer to 70.
Maybe it's closer to 70. Maybe it's 70 to 80. I don't know offhand the true number. You're right. I think it's like 75. I'm thinking of our map that we have on our website. But we can send that to you. But we do have that, and it's available. And that relates to our Kentucky Entertainment Incentive Program. It relates to our Kentucky Business Investment Program. It pertains to our Angel Program. So investments and jobs and things that are being created and included in those communities actually are eligible for a higher incentive or a higher benefit.
Okay. Thank you very much.
And
Thank you,
excuse
Mr.
us for
Chairman.
not knowing that number off the top. Right, we annually have to recertify. So we're in that process right now, and because we just incorporated to that definition areas of disaster relief, that's why we're kind of sitting here saying, was it 58? Was it 74? Was it, because we're having to look at those numbers.
Well, I think an example of what Dr. Senator Douglas has talked about is if we look at healthcare, 40% of our population is considered rural in Kentucky, but only 17% of primary care physicians practice in rural communities. And so that kind of disparity creates all kinds of problems, not just for the community, but downstream. And one of the things that we passed this last legislative session was to develop a Medicaid payment methodology based on the National Deprivation Index. So is that information that you folks have considered or would consider as well? Because that's just not rural, that's also urban. And you can do it by zip code. So I'd like to see more of our fiscal policies aimed at using that index so we can specifically hone in on those communities that are most disadvantaged so we can get those resources to them.
Thank you for that recommendation. It's appreciated.
Any other questions? If not, is there a motion?
So moved.
Second.
Motion by Representative Hart to approve the contract, seconded by Senator Douglas. All those in favor vote aye. All opposed vote no. Kim, please call the roll.
Senator Boswell.
Aye.
Senator Douglas.
Aye.
Senator Yates. Representative Chester Burton. Representative McCool.
Yes.
Representative Pollock.
Yes.
Representative Hart.
Yes.
Chairman Meredith.
Aye. Motion is approved. Thank you all for being available to us this morning. Very educational, very informative. You committed, Senator Boswell, that you would give him those definitions. I'd like to see those as well. I assume all the members of the committee would like to see that.
Is it okay if we just share it with committee staff and then they can disperse it?
Oh, no, I want personal attention. No, that'll be quite appropriate.
Thank you.
Thank you. Appreciate it. Have a blessed day. Appreciate it. The next item on the pulled list is with the Kentucky Employers Mutual Insurance, and it's number 51 on the routine PSE list. And we do have representatives here live and in person. We like live and in person. Good morning. If you would, please identify yourself for the record.
Hi, I'm Allison Smith, Associate General Counsel for Kentucky Employers Mutual Insurance.
If you would, please raise your right hand. Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth?
Yes.
Again, thank you for being here this morning. I request this contract being pulled, and it's, again, kind of the educational aspect of it. $400,000 contract to do an injury triage service. And it says in our description here, this toll-free number, and that the service will recommend the employee to return to work with self-care, first aid instructions, or receive medical care at the designated medical facility. Does this group work like a managed care organization?
So this group works in part with our managed care organization. And so this is a service that our policyholders, that our underwriting team offers to our policyholders for their employees who may be injured on the job. And so it's sort of a first step to streamline an injured worker's care so that they have a nurse that they can call and figure out how to either quickly get back to work or most efficiently access our managed care organization so that they can seek treatment within it.
Well, my concern, again, it goes from a rural perspective, is network adequacy. If they're making a referral to a medical facility that's not in the immediate area, transportation presents a problem. If they have to do rehab in an area that's not within their home community, that presents a problem. So how do you all monitor network adequacy with your managed care organization?
That is something that I believe the Department of Workers Claims actually monitors. And so in order to have a managed care organization that we use, we have a managed care plan that we file with the department. This is something that has to address where, our network of service providers, where they're located, how they're licensed, how we access them. And it is required that we have care available within a certain geographic region for our injured workers. But certainly it is difficult, as you mentioned, in more rural areas for there to be care available to them. But it's something that is really important to KIMI and our managed care network, that we're able to get available care quickly to our injured workers.
Now, excuse my ignorance, but who is your managed care organization?
We have our managed care organization through OMCA, and so they provide our managed care.
As part of the RFP for that, and I assume there's an RFP, is there a requirement for network adequacy? Is it?
There is, yes. That is. We did procure our managed care organization through an RFP, as we did this individual triage service as well, and there is a requirement for adequacy, yes.
What level is that set at? Is it 90%, 95%, or?
I'm sorry, I don't know the percentage.
Well, again, it's just been my personal experience that it's working with the Medicaid MCOs who all say that they have 95% network adequacy, but when you look at the actual numbers, it's significantly less than that. So again, my concern is that workers may not be getting the services that they need, or they may not be able to get them within their home community, which provides additional burden upon them. So I don't have an alternative for you. It just, that's a concern I have with contracts of this nature. But is there a recourse for employees? I assume that. Walk me through it. An employee has an injury. Who makes the telephone call?
The employee himself or herself makes the telephone call. A nurse then answers the telephone call. The employee explains, what may be injured, how the incident occurred, and then the nurse makes recommendations for how the employee should proceed.
Okay, let me give a weak example. I have what I think is a sprained ankle at work. So I call this number, talk to a nurse. She tells me either to ice it, elevate it, and follow up with the provider in 2-3 days. But what if I think it maybe is a torn ligament and needs immediate attention, is there an appeal process for the employee?
There's actually no requirement that the employee follows what the nurse is saying. It's really just a service to help both the policyholder and the employee if they have questions or want to streamline the process. But in your example, your ankle is hurting really badly. You think, okay, she's recommending that I ice it, but that doesn't seem like that's something I want to do. You could say back, I think I need to go on to urgent care, or I would like to go to the emergency room or see a primary care physician. At that point, the nurse would share with you, okay, these are the 5 nearest emergency treatment centers that are within KIMI's managed care organization, and you could go on to whatever treatment you saw suitable.
Senator Douglas?
Thank you, Mr. Chairman. The employee makes the call. Does the employee make the call after they've alerted their supervisor?
That's correct. Yes, Senator Douglas. The employee will first notify their supervisor that an injury has occurred. You're correct.
Is, to your knowledge, because this is an area where I've spent a lot of time, would the provider be aware of what the injured worker's job description is?
I'm not sure the answer to that question. I would hope that they could share about what the type of job is doing.
Doesn't happen.
But I'm not sure.
Okay,
And
it typically doesn't happen, but I just wondered.
I can understand.
Thank you. I'm sorry.
You're
I'm
welcome.
sorry to interrupt you, but thank you, Mr. Chair.
Senator Boswell?
I'll just make a comment. This is an area where I know a lot about too. At one time I had 500 employees, and I was that position. I was this person, and I required all my employees, they were hurt, to make the initial call to our office so we could talk to them.
Yeah.
Sometimes they had possibly a sprained ankle. They didn't necessarily have to go to the hospital. For example, we might say, would you go home for the rest of the day and rest your ankle and call us back tomorrow? And now, so many times it actually ended up avoiding a major workman's comp expense. And Kentucky Employees Mutual's done an excellent job over the years and trying to mitigate their losses through a program like this, and I think it could be very effective.
I appreciate your
So I
comments.
think
Thank
you're
you.
doing a good job in this particular area.
Thank you.
Thank you, Senator. Representative Hart, a question?
This is more for my curiosity, because I know during 2020 and with the COVID pandemic and stuff, we've started utilizing telemedicine more and more. This particular service that you're offering, as far as the triage aspect of it, would you say, and you might not know, but is it predominantly telemedicine, or is it more phone calls, or is it a mixture? I'm just curious I'm trying to gauge how much the telemedicine arena is being used past COVID.
That's a great question, and I don't have the answer to it. The initial phone call to the nurse is always a phone call, right? And then the nurse at that point can recommend telemedicine, an actual in-person visit, other things like that. I don't want to speculate, so I'm not sure the actual percentage of our claimants that are using telemedicine, but it is not something that I've heard talked about very frequently. Like I said, I don't want to speculate, but my gut instinct is that a lot of the care is still happening in person in these claims.
Okay, thank you.
No one wants to speculate this morning. I don't understand what's going on here, but
I guess the attorney in me, once you swear us in, I get nervous. I want to answer your all's questions as completely as possible, but to speculate doesn't do any of us very good.
duly noted. Any other questions, comments? If not, entertain a motion.
Make a motion to be approved.
Motion to approve by Senator Boswell. Is there a second?
Second.
Second by Senator Douglas. All those in favor of the motion vote aye. All opposed vote no. Kim, please call the roll.
Senator Boswell. Senator Douglas.
Aye.
Senator Yates. Representative Chester Burton. Representative McCool.
Yes.
Representative Pollock.
Yes.
Representative Hart.
Yes.
Chairman Meredith.
Aye, motion carries. And I will speculate that probably you're glad that you can go home now, so or back to work. But
I appreciate it. Thank you all, and thank you again for your comments.
thank you for being available to us. Greatly. Next item on the pull list with Kentucky State University is number 64 on the routine PSE green list. Good morning. Glad you enjoy. If you would, please make sure your microphone's on. Should be a green light. If you would identify yourself for the record. Glad to have you on board. If you would, please raise your right hand. Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth? Make sure that green light is on. It isn't? Okay. Might pull a little bit closer then. Brand new to Kentucky State University. First time before our committee, I believe. Yeah. You doing okay? Did anyone tell you what to expect? Did they tell you why you're here today? Well, one of the, I'm going to say deadly sins of this committee, it's certainly one of my deadly sins, is to give us a retroactive approval request for a contract, because it's after the fact. There's nothing we can do about that. And just to give you a little history, many years ago, we used to get these on a routine basis, and that's not the best way to do business. And this is a retroactive request. I did receive a letter with explanation, but I don't know that I find it totally acceptable. But just want to make sure everybody understands the process. Is still not sure why this contract did not come to our committee on a timely basis. Can you explain that? Excuse me, I'm going to ask, could you change microphones, because I'm not hearing. Is it on? Make sure it's on. Green light.
Yep. Oh, here we go.
Yeah, there we go. Yes, success.
So actually, we started this project, I guess, last year. RFP was posted last year. We've had a transition between purchasing directors. We had one purchasing director was going to a different area within, and a new transition was coming in. And I think this may have gotten caught up in the transition. We've actually had this prep since February. We've been trying to get it on since March. I guess something was missed coming here for April, but it was on our board for approval. And then the same thing happened in May. We was informed that internally with the new person that it was transmitted to the wrong person, so it wasn't able to be on for the May. So subsequently, we're here now.
Well, we do understand. I think I can speak on behalf of the committee in our legislature that these are very tumultuous times for Kentucky State. You have our utmost support in trying to right the ship, and we know there's a challenge associated with that. So I would personally give you a pass on this one.
Thank you.
But please note that we prefer to these things rather than retrospectively.
No, I really appreciate that, and I think with the partnership that we have with CPE as part of the management improvement plan, these are some things that we're putting in place. Actually, this PSC is going to help us put policies in place and update our policies to ensure that people are being cross-trained, and you have succession plans in place, and this is also included in this study.
So can we blame this one on Dr. Thompson?
I can't speculate on that.
Senator Boswell, you have a question or comment?
For any organization, ever so often, I can see the need to do exactly what this RFP says. You go through and you check all these categories. But is this going to be an annual thing, or is this a one-time?
This is a requirement of HB 250 as part of the management improvement plan. We're required to do this
on an annual basis. Just once.
I can't confirm if it's going to be annual. I would defer to our newly elected president-elect, Dr. Capo, to see if this is going to be part of the strategic plan going forward.
Okay, well, I certainly would be willing to approve this, but I'm not sure I would be willing to approve this be done on an annual basis, because not very many businesses would do something like this every year and expend this kind of money, especially at times when things are kind of tight. So I don't know if we should. I guess we'll be looking for it again next year. If we see it, we might be concerned about it.
What do you want to speculate as to whether this might be annual or not?
I would
won't ask
prefer
you to
not
do
to speculate because I'm not in that. We can provide recommendations to our newly elected president about going forward. I know the intention of this was purely a one-off for this year, part as the management improvement plan that then set whatever the findings come from this. We need to make sure we find the resources for the equitability. We need to find the resources moving forward. But for this, we're looking for the baseline to set our long-range planning, which I don't think it may be annually at that point. But again, I think I would prefer our executive leadership set that direction as we move forward.
I would agree with you. I think the intent was that this gives us the baseline to work from, and as we move forward, looking at employee staff retention, then it could be more frequent, but we will see. But appreciate that. Senator Douglas.
Thank you, Mr. Chairman. First of all, I want to welcome you. Thank you for being here. I realize this is a contract for 7 months, if I'm reading this correctly, and it says upon receipt of invoices. So this may not all be spent. Is that my understanding?
No, so I think it all will be spent. CPE graciously gave us $150,000, and we're only on the hook for about $49,000. So right now, with the current contract, all of this will be spent.
Because?
Well, this was part of the scope of work. The scope of work that we negotiated for the RFP. Through the RFP process, multiple companies bidded on. And the committee that ultimately selected this identified the scope of work, and actually we had to rewrite the scope of work to get it down into a reasonable budget that we was afforded to get. So we are anticipating that this full amount will be spent. And part of the contract, I think there was a portion in it, if I remember correctly. I think the invoices are like $32,000 or $33,000 per month. After the initial preliminary meeting with Gallagher.
Thank you, Mr. Chair. Thank you very much.
All right, thank you.
Any other questions, comments? If not, I'll entertain a motion. Motion by Senator Boswell. Is there a second? Second. I'm sorry, who hit the second? Representative Pollock. Thank you, sir. All those in favor of the motion vote aye. All opposed vote no. Kim, please call the roll.
Senator Boswell.
Aye.
Senator Douglas.
Aye.
Senator Yates. Representative Chester Burton. Representative McCool.
Yes.
Representative Pollock.
Yes.
Representative Hart.
Yes.
Chairman Meredith.
Aye. Motion carries. Thank you for being available to us this morning, and appreciate the information, and wish you the best of luck going forward. If you can ever be of assistance, please let us know. Thank you.
Thank you.
Next item on the pull list are with Kentucky Public Service Commission on number 71, 72, and 73. Good morning.
Morning, Chairman. Kent Chandler, the Chairman of the Kentucky Public Service Commission.
Appreciate you being here. If you would, please raise your right hand. Do you swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you. I'm not sure whether I should require you to do that or not, because I really don't have any questions. My issue is the issue I always have with contracts from California. I don't like them.
Yes, sir. So just two of them on their face. Two of the contracts were approved by the committee last June.
Recall.
And their amendments because of the, I guess, change of name of the organization. They've changed their federal ID number, so they have to come back. One of those expires at the end of the month. We put out an RFP to replace that contract that expires this month, and that is the non-amended application, the one ending with a PON 2857. I've got that we had that out for an RFP for 4 weeks with one respondent, and that was the respondent that we chose as the vendor.
Duly noted. Just for the committee's maybe information, we're one of 26 states that California has boycotted because of legislation passed. And interesting enough, beyond the state of California, there's specific metropolitan areas such as San Francisco is taking the same action. But San Francisco has recently decided that doing so was a mistake, and they are attempting to rescind that restriction upon us, but it is what it is. I think it still is very unfortunate that we do business with a state that wants to harm us economically because of legislation we passed, which has no impact on them whatsoever, but it is what it is. With that, I'll entertain a motion. Representative Pollock? Motion? Is there a second?
I'll second that, but I'd like to just explain my second.
Well, certainly.
I think as we go forward, Senator Meredith, I think you've got an excellent thoughts about this, and I think we're going to look even stronger as we go on. If we continue to be, if California continues to deal with us, I think that we're going to have to start doing the same thing. Not today, probably.
Thank you, sir. Appreciate that. There's a motion and a second. All in favor of the motion, vote aye. All opposed, vote no. Kim, please call the roll.
Senator Boswell. Senator Douglas.
Pass.
Senator Yates. Representative Chester Burton. Representative McCool.
Yes.
Representative Pollock. Representative Hart.
I'm going to explain my yes vote because, like Senator Meredith, I've been one of the few people on this committee for the past several years that's been trying to bring attention to this situation with California. Unfortunately, our administration and other folks within our state government failed to recognize it. But I will vote yes on this since the two of the contracts have already been approved. I don't want to hamper anything that's already in progress. But to echo Senator Boswell's concern there, we're, as a state, if we're going to allow other states to try to intentionally inflict economic hardships on this state and we continue to do business with them, it's going to create such a domino effect eventually in this state where it's going to hurt us. And we as the legislator and as the government of this state need to address this, and we need to address it head on. And so I will continue to push for disapproval of California contracts in the future because of that. But under the circumstances, since two of these contracts have already been approved, I don't want to impede that, so I will vote yes.
Chairman Meredith.
I'm a symbolic no. We have enough votes to pass, but someone has to stand firm. Representative Hart, no. Not attempting to cast any dispersion on anyone, but Eagles fly alone. Motion passes. I appreciate your tolerance.
Thank you, Senator. I appreciate it.
Thank you.
There could be a D.
Next item on the pull list are Morehead State University, and number 79 and 80. If representatives are here or virtual, please identify yourself for the record.
Yes, Mr. Chairman, I'm Kim Oatman, and I'm with Morehead State University, the Chief Facilities and Operations Officer.
Are you solo this morning?
Yes, I believe I am. I had the Director of Procurement, but she had to step out to another meeting at 10.
I mean, she didn't want to hang around for this entertainment? That's
No, so I think she was having fun, though.
I won't take it as a personal offense. We're looking at 79 and 80. If you would, please raise your right hand. I'd ask that you, do you swear or affirm to tell the truth, the whole truth, and nothing but the truth?
I do.
Have you been watching us all morning?
Yes, sir.
So you were privy to the conversation we had with Eastern Kentucky University? And
yes, sir, I was.
That's my same issues with your two contracts is they're $500,000 each, but it doesn't really give us a whole lot of information. Again, this isn't a process that you folks created, but I would ask the same commitment from you folks that we got from EKU, that you would provide us with follow-up reports to actually how much we have spent of this amount that we're agreeing to appropriate. Is that fair?
Fair enough. Yes, sir.
Okay.
Glad to do that.
Any other questions, comments, committee members?
Do you have an idea, just off the top of your head?
Yes, sir. In the past year to date, the one for architectural services, we spent about $130,000. For engineering services, about $190,000. And that comes really because of all the, we were blessed to have a fair amount of funding for asset preservation projects, which we greatly appreciate. And we've had to rely upon these outside services to help us for these designs.
Any other questions, comments? If not, entertain a motion. Motion, is there a second?
Second.
Motion and second. All those in favor vote aye. All opposed vote no. Again, please call the roll.
Senator Boswell. Senator Douglas.
Aye.
Senator Yates. Representative Chester Burton. Representative McCool. Representative Pollock.
Yes.
Representative Hart.
Yes.
Chairman Meredith.
Aye, motion carries. And thank you for being available to us this morning. We appreciate your time.
Thank you, Mr. Chairman.
Next item on the pool list with Department of Education are number 75, 76, and 77 on the routine MOA, which is our pink list.
Good morning. My name is Karen Worth. I'm with the Division of Budgets and Financial Management.
Good morning. My name is Reagan Satterwhite. I am the Policy Advisor in the Office of Career and Technical Education at KDE.
Thank you for joining us this morning. If you would, I'd ask you to raise your right hand. Do you swear or affirm to tell the truth, the whole truth, and nothing but the truth?
We do.
I do.
Thank you. Please excuse me while I find my notes here. All right, it's coming back to me now. Forgive me. I turned 70 this year, so memory ain't what it used to be. I'm always curious and concerned about funding for these projects, and we're looking at a 100% funding from the federal level on number 75 and 100% on from the general fund on 76. And this goes like what either one of these programs is, specifically the federal portion. What happens when if that funding goes away?
So if it would be then a department decision as to whether or not we chose to find another fund source to continue that, or if the school or district or co-op or university would be able to take that role for us and fund it. So it would be a matter of looking for an alternate fund source.
Have you ever had programs that have been a victim of that before?
We have not in these type of positions. We have 13 program areas in career and technical education, and we have 11 program consultants, and we have not run into a situation where we have lost funding for one of those consultants.
Well, the one that's 100% funded from our general fund, obviously we're coming up on another budget cycle in this next year. I hate to put you on the spot, and I'm going to ask you to speculate. Do you think you'll be asking for an increase in funding for that program, or will it be the same?
No.
There won't be.
Okay, well, that's good, because I think we're going to have a very difficult budget. That's all I have. There's a motion to approve 75, 76, and 77 of the routine MOA pink list. Motion, is there a second?
Second.
Second. Kim, please call the roll.
Senator Boswell.
Aye.
Senator Douglas.
Aye.
Senator Yates. Representative Chester Burton. Representative McCool.
Yes.
Representative Pollock. Yes. Representative Hart.
Yes.
Chairman Meredith.
Aye, motion carries, and thank you for being available to us this morning.
Thank you.
Final item on the pool list are also Department of Education, number 38 through 45 on the MOA, 50,000 and under is our gray list.
Thank you.
I see we have a handout. If you give us a moment to review that, I'd appreciate that.
Absolutely, especially the first three bold items.
This is the second round we're seeing on some of these. Can you give me an idea, kind of a summary of what the global plan is? Are we going to have one of these in each of our 171 school districts? Will each school have one? Is that the goal?
We would love to. Do we need to be sworn in, or we can?
Yeah, I'm sorry. Yeah, I'm getting towards the end here. If you would, please identify yourself for the record.
Yes, my name is Dr. Thomas Tucker. I'm the Deputy Commissioner for the Kentucky Department of Education and Chief Equity Officer.
My name is Dr. Damian Sweeney. I'm the Director of the Diversity, Equity, Inclusion, and Belonging Division.
Karen Worth, a Division of Budgets and Financial Management.
Again, not to be redundant, but if you would, please raise your right hand, and do you swear and affirm to tell the truth, the whole truth, and nothing but the truth?
I do.
I do.
I do.
Thank you. Appreciate it. Again, my question was that what kind of the global plan is for this. Will we have one in each school within our 171 school districts?
From my perspective, I wish we could. As you know, the Kentucky Department of Education cannot mandate such, but if you look at the research and of the effectiveness of our common spaces, early research, you can see it's certainly something that we need to consider. And then on the second and third pages, you can see the research, scientific research behind common spaces, but the first page is really grounded in Kentucky. This is what's happening, especially in our rural areas. These contracts are in primary rural districts, and I'll ask Dr. Sweeney if I'm correct in that, but we would love this. If it's something that's good for one district, it should be good and it's working to help staff out, helping students out, decreasing disruptions, as you can see from the first three main items. It's happening. These are from the voices of people in the field.
My concern is always we've got theory and practical application. And, I kind of envision that we create these spaces, and after a period of time, they become a supply closet. So can you kind of walk me through how this whole process works for a student?
Yeah, I'll make one quick comment, and Dr. Sweeney, I know he'll eloquently explain this a lot better than I would, but this is exactly, Senator Meredith, this is theory meeting practice. This is theory meeting action in your Kentucky classrooms. Dr. Sweeney?
Yes, so thank you, Dr. Tucker, and thank you for your question, Senator Meredith. All districts and schools that have these common spaces are required to have a sustainability plan. They're also required to work with students to teach them how to use these, along with working with families. Many of our families have already reported that their kids are using these strategies at home as well. So sustainability is at the forefront, and it should not just become a supply closet down the road.
Well, very elementary. Tell me how it works.
Okay, sure. Can I give you a personal example?
Yeah, please.
Okay. My I have 3 sons, twins that are 7 years old in the
God
first
bless you.
grade. I know. And then a kindergartner that's 6. One of my sons, it was a hard transition to elementary school. So one of the things that his teachers quickly realized is that he needed an area of the classroom where he could walk and just take a moment to collect himself. They actually allowed him to bring a stuffed animal to class, and he could squeeze that stuffed animal to emotionally regulate, right? Because of this, he would not have outbursts in class, outbursts in classes. He would be able to be more amenable to teacher instruction, to his peers, etc. And the same thing is the same concept, right? So we've got calming spaces in the corners of classrooms. If a student is feeling dysregulated, or that they are going through something, they can take a moment, take a quick break. They have been informed and educated on how to use these spaces. They can go there, they can either use a fidget, they can color, they can take that moment of mindfulness and then reinsert themselves in that learning environment once they're ready. And normally there's a timer, so it's not like they're going out for an extreme amount of time. Normally it's 3 to 5 minutes.
Say 3 to 5 minutes?
Yes.
So this may not be a designated room. It could be designated space within any classroom?
That's right.
Okay.
Yeah, that's right.
Yes.
Are you concerned about the, for want of a better term, stigma associated with being sent to this space?
Not at all. And students aren't sent there often. Because of that instruction that they've been given at the beginning of the school year and about those spaces, they can opt in. Our research is very clear about today's youth. They want to destigmatize mental health. They want to destigmatize needing that moment. And so we don't anticipate that issue. And we have research right here from not only educators who have these spaces in the classroom, but also students. Who have said things like, this has helped me feel supported and safe within the classroom. Several also stated that they're using these techniques, as I mentioned earlier, independently after they practice at the common spaces daily or a few times a week at home.
Yeah, and the last thing I'll add with that Senator Meredith, and I'm sure others are probably thinking the same thing, is that's a very powerful question, stigmatization. And generally, it rests with students who are unique learners who have 504 plans or IEPs, what we call students, special ed students, and I understand that. But what's powerful in at least one school district, and it may be more, is that administrators are reporting that based on the success of the general classroom implementation, other staff will be implemented. So you're going beyond our special education classrooms to the general classrooms.
Obviously, I'm old school. Back in the day, kids would be sent to the principal's office. The stigma associated with that as well. Or you're pulled up to sit by the teacher's desk. So that's why I'm trying to conceptualize this thing is how this looks different. And I understand what we're trying to accomplish here, but just want to make sure that there isn't any adverse effects as a result of that. Another question I have is,
sure,
how are the parents engaged in this process?
And that's part of the whole grant process to be qualified. It has a parent engagement piece to it. And I'm old school too, and unfortunately I have to admit that I was called to the principal's office. I was disciplined in the classroom.
Everyone
then.
up here has been.
Yeah, and disciplined in the principal's office. Okay, Senator Dr. Douglas says he's not. He's not. But what's different, as Dr. Sweeney said, students are opting in. They're opting in. They're our teachers, support staff, and administrators at the local level are doing such a great job in helping to empower students. And so when students are saying, I'm coming here for whatever is happening, a rough day, I need 5 minutes to de-escalate. So they're opting in. It's not seen as punitive.
And part of the contract states, and a goal and deliverable is continued community and family engagement throughout the school year of implementation of the calming space. We know that schools can't work independently of our families. There has to be a partnership. And so our families are getting this information. This is how you can help your students or your children de-escalate when they're at home. This is how you can help them emotionally regulate when there is a conflict with peers or siblings, etc.
Do we limit this just to elementary school age children?
No.
No, this is through high school.
All with high
Elementary,
school.
middle, high school.
And the districts have the option to choose which schools and which levels get them.
Excuse me for being a little bit cynical, but I'm going back to my high school days, and all of us have acknowledged or admitted or confessed that we spent time in the principal's office. But particularly for the older children, how do you assure that it's not call this a privilege? This privilege is not abused.
There's no way we can 100% ensure that you don't have a student who's asking for this calming space. But when we look at how closely we are watching the data, and I do appreciate the Government Contract Review Committee for asking us to ensure we're keeping an eye on the data and looking at effectiveness. But that's one of the survey questions. We're surveying staff to ask, are you witnessing students firsthand who are taking advantage of this? And 95% of the survey respondents found that the calming space helps students emotionally regulate and self-image, and they were surveyed and asked if they felt students were taking advantage of this, in which it could happen, and that response was extremely low. And we'll continue to ask that question to ensure that students are not taking advantage of this opportunity to de-escalate.
Well, I certainly see the value of it for younger children. I have to admit, I'm a little concerned when you become a sophomore, junior, senior that you're getting ready to enter the adult world. And when you had a bad moment, you don't have a timeout. You don't have a safe place. You don't have somewhere to go. Are we really conditioning our young adults to function in the real world?
We're working towards that with family support and with expectations from our lawmakers, with expectation from our business folks and other folks in the community. As someone said earlier, the school district can't do this alone. I mean, it takes an entire village to raise a child. And I do appreciate Senator Boswell's immense question about inclusion, how you define it. Inclusion means everybody, each of you, everybody in this village is responsible for helping to raise the child. Now, primarily it's the parents' responsibility, but inclusion is everyone. And this is just one of the mechanisms we're trying to help our students before they get to, as you mentioned, before they get to the middle school and senior high level to de-escalate. Now, we do know we see school violence at the elementary level, but we need to make sure that we're providing these services to students at the middle and high school level and keeping parents actively engaged.
Senator McCool, you have a question, comment? I see you're trying to head out, and here I cut you off.
And trying to catch them all, but and that being jet lag coming in last night, I don't think I'm that swift today, but I do find it very interesting. I just wanted to make comments with this safe space. It is K through 12. I do have concerns about later on, is that preparing them for the world of work? And also, are these safe spaces, are they monitored? Is there anywhere, any safe space where they do not have some type of supervision and I've got multiple questions. I find it interesting.
Yeah, it is monitored. And Dr. Sweeney, anything you want to add again about the setup, especially talk about how it's monitored?
Yes. So again, these safe space, these calming spaces are often in the classroom. They can also be in a school counselor's office. They will always be monitored. There will always be supervision. If I can just add the other piece is that, you know, we all, even as adults, have moments of frustration, and we need a second, you know. And so this isn't saying, you know, we're going to be able to go and go to a calming space. However, we do have to have emotional regulation skills in order to thrive as adults and as workers and as teammates. And so this is teaching those skills to students.
And I agree, we do need to be able to do that, but at the same time, in the world of work, they're paying you by the hour. They're not going to let you go over to a safe space. They're going to say, figure it out and move on. I mean, that's just being real.
And you're absolutely right about that. But I want to make sure that this point has not gotten lost, and my team that works with Dr. Sweeney makes this important point, is that we're building the skills early on, so when they get there, they will have the capacity, they will have the skill set to learn to self-regulate. It's just like a student who has a 504 plan or an IEP needing special assistance. I have a student who has a 504 plan. When he goes out to work or goes to the University of Kentucky or Kentucky State or anywhere here in Kentucky, he will not have that full level of support that he's been given in K-12.
Representative Hart.
I like the notion of elementary age kids, teaching them how to take a moment, you know, and instead of acting on their frustrations, you know, take time, calm down a little bit, think about it before you act. I think that's an excellent lesson that we need. The only thing that I would say is as you move forward, and you've mentioned this, and I think you're probably working towards this, my concern would be as we get into the high school age years and stuff, that we don't allow the students to look at this as a crutch when we're trying to teach them a tool to help them in everyday life. Because, you know, you can take a moment by just going to the restroom and just taking a breath or stepping outside for fresh air. So I think what you're all trying to do, my wife's a middle school teacher, and listening to her stories and stuff throughout her career, I think there's a lot of validity in doing this, especially at the very, very young ages. But I would just, and I'm sure you're aware of it, I just wanted to comment, as we move into the high school, my concern would be don't let the students develop a crutch here. Let them realize this is a mechanism or a coping thing that they can use throughout life, and try to come up with a way to to emphasize the fact that, you know, when you get into the real world, it don't always happen this way.
Yes,
so
sir.
it's just something I wanted to comment.
What happens after September 30th this year?
One of the big parts, again, that's in the almost 3 years I've had the pleasure of working with you all, I hope we've gotten a little smarter and can really understand what you all want and anticipate, and suggestions that you give us are great suggestions, is sustainability. What's built in the grant application is a sustainability plan. And Dr. Sweeney, I don't know if any of our grant recipients have articulated what their sustainability plan is, but in order to receive one of these small grants, it has to be some sustainability part of it.
It's just part of the RFP that they complete.
And what can you give me some idea of what those sustainability plans look like?
They will continue to look for other grant funding, the federal government, and again, not counting exclusively on the federal government, but the federal government offers long-term funding for several years. Sometimes the funding could be 3, 5, 10 years. The local PTAs, PTOs can provide funding. And many of our school districts have scholarship foundations or education foundations. They would write a mini grant just like they would here. And those local scholarship foundations or alumni foundations would provide money. I've seen schools and school districts receive money in that matter. And the big question we heard this morning, you may have to reallocate things in your budget. Put your money where things are important.
Exactly. When you can show as a school principal or school leader that behavioral referrals have decreased by 60%, in some cases 80%, then your district is apt to continue supporting that initiative.
I would think they would. What does $10,000 buy you?
Oh gosh, so much. We have so many examples, and each of the contracts, they actually break it down, beginning on page 4. And so this is just an example from Henderson County. They're purchasing privacy structures, common cubes, wooden playhouse tents for their elementary students, canvas tents, soft floor surfaces, interlocking plush foam mats, round fluffy circle rugs, traditional rugs, soft lighting, soft seating, etc.
Okay, thank you. I'll be interested to see the data on this in the future. Certainly this is a new venture for a lot of people. I do understand the concept. If I have any reservation, it goes back to what was mentioned earlier about at what age do you say you got to learn to deal with it as adults. But I will look forward to the future data as to what schools are realizing, but appreciate your efforts, and I also appreciate you see it as a pleasure to come for our committee. It's a pleasure for me as well personally. It's always an education. I appreciate the information and appreciate your patience with us and indulgence, and my concern, and I think it's shared by many of the commitment members, we've only got so many dollars for education, and where are we spending it for the greatest the good and the greatest returns, and it's a challenge for all of us to know that it is, but appreciate your all's patience with us. And with that, is there a motion on this? I'm sorry, Senator Douglas. Didn't see you there.
Thank you, Mr. Chairman.
I'm going to send you to the principal's office.
For the first time. Yeah. I was in the principal's office, but that was when I was in college, and I went back and visited my principal. I have a question, because I really have concerns in this space, as you all have seen, but at least I'm consistently concerned. And I do want our children, and I want our school system to do what it was designed to do. All right. Which is educate. And I have a huge concern that our school systems are being asked to do more discipline than education. Now, with that being said, and this is, I want a 30-second answer. This is not a hard question.
Sure.
And anyone can answer this. In your interpretation, or at least how do you assess, has research given up on parents raising their children?
I can answer in less than 15 seconds. Absolutely no. The third page scientific research shows that the importance of parental involvement.
Because one of the comments I heard just a little bit earlier was we talked about the village raising the child, and we spent, several sentences on that. Then there was sort of almost an afterthought of saying, well, of course, the patients do have some responsibility. And that's not a criticism. It's simply an observation. I want you to know that it's simply an observation. I'm a big education supporter, but I keep seeing us going down a road that is asking our consumers, some people would say people in the village, but our consumers who are producing cash flow to put more money into raising our children. And we can argue all we want that those people who may not be in a position to provide much in the way of tax dollars toward educating our children just don't have the tax dollars to do it. My big concern, and this is ladies and gentlemen, I want you to know this is an extremely sincere concern of mine, is that we will not engage that group because we are essentially giving them a by saying we will raise, we will discipline, we will take over however many children that you choose to have, because we don't think you have the tools to do it adequately. And my huge concern is that in doing that, they will never, again, we are going to have a general population of parents who do not have tools to take care of their children. I just want to express that as a concern. But thank you. I want to thank you all so very much. I know sometimes you sit there and wonder, what is Senator Douglas going to ask me? You know, is he serious? I am damn serious. I was married to a lady who taught special needs kids for 30 years. This is not something that is really, really, really removed from my home. This is very intimate in terms of the contact that I have had over the years in the education space. But I really want to thank you all for the hard work that you're doing. Thank you very much, Mr. Chairman.
Thank you. If there are no other questions, comments, I'd entertain a motion to approve.
So moved.
Motion by Representative Hart. Is there a second? Second by Senator Boswell. All in favor, vote aye. All opposed, vote no. Kim, please call the roll.
Senator Boswell.
Aye.
Senator Douglas.
Explain my vote, Mr. Chairman.
Yes,
I vote
please.
no. The reason I vote no is just what I'm talking about. I had a calming space, but my calming space was at home. And my calming space began way before I was 5-6 years old. And I'm concerned that we are holding our parents back from having to develop the tools to take care of the kids. I'm concerned about education, which is what our taxpayers are putting their money into the education system for, versus teaching the kids discipline, which they obviously are not, and we can pretend they are, obviously are not getting at home, at least the consistency of discipline. And yes, I do know about this space, this special education space. I'm concerned that we talk about mental health in these children when this is not a mental health issue. This is a consistency, discipline issue. I always told people I thought I had a learning disability for the longest time growing up, but my mom and dad taught me how to not have a learning disability. I thought it was my way, and guess what? I was taught that my way had nothing to do with it. And I am grateful to both of my parents. And we had 16 in our home, not 2 or not 3. I want us all to come together and be serious about educating our children in this country versus this discipline issue that we have where we don't want to hurt the kids' feelings. Education is not about feelings. Education is about education. And with that, I'll shut up. Thank you, Mr. Chairman.
Senator Yates. Representative Chester Burton. Representative McCool. Representative Pollock.
Yes.
Representative Hart.
Yes.
Chairman Meredith.
I'm an aye, and I'm in complete agreement with Senator Douglas's comments, but I think what's lacking today is a lot of people don't know how to be parents. And I see this as a refuge for children who don't have that blessing that he obviously had, that I obviously had. And I wish maybe we need to spend our resources on teaching people how to be parents again, rather than focusing on the kids and it'll trickle down. But another discussion. Motion passes. Appreciate you all being available to us as always, and thank you very much. We have one other item of business before we adjourn. That's we have 4 exemption requests, and these are all the same. That it's a 2-year biennial contract which extends beyond the biennial. So that's the reason for the exemption request. Is there a motion to approve?
So moved.
Motion and a second. On Kim, please call the roll.
Senator Boswell. Senator Douglas.
Aye.
Senator Yates. Representative Chester Burton. Representative McCool. Representative Pollock. Representative Hart.
Yes.
Chairman Meredith.
Aye. And folks, before we adjourn, let me remind you that in our July meeting, because of CSG, we will be meeting at a different date. It's Thursday, July 13th at 9 a.m. So please make sure you've updated your calendar that it's a different date. Is there a motion to adjourn? Second. Second by somebody. All in favor say aye. All right. Thank you. I know. That's why I hurried it through.